Hey everybody, my name's Erin, and for our Women's Health Project, I chose to focus on obesity in the country of Mexico. So let's get started. For organization purposes, I did split this into three parts. Part one, discussing the demographics of the health issue chosen. The textbook definition for obesity is the abnormal or excessive fat accumulation that presents a risk to health. It is also considered weight above what is healthy, often measured using BMI. Now, BMI is the body mass index scale. The World Health Organization defines BMI as a simple index of weight for height that is commonly used to clarify underweight, overweight, and obese adults. It is worth noting that BMI is primarily used for adults aged 20 and older. It is not used for children or babies. They have a separate way of measurement as they are still growing and developing. Obesity is also a chronic disease with well-defined pathological implications, so it is a far-reaching disease as it encounters physical, mental, and emotional properties of a person, now including cultural. And surprisingly, this disease is totally preventable. The concept of being overweight is really only a few decades old. Food scarcity and insecurity was a worldwide issue for thousands of years. I mean, think about it. Our ancestors hunted and gathered for their food. It was never secure, and they did not know when they were going to eat again. However, as we have evolved as humans, technology has as well. Technology has decreased the amount of time it takes to mass produce food while increasing accessibility to it. This disease is a result of evolutionary process. At a basic level, weight gain, eventually leading to being overweight or obesity, is determined by a balance of energy. When we consume more energy, typically measured in calories, than the energy expended to maintain life and carry out daily activities, we gain weight. This is called an energy surplus. When we consume less energy than we expend, we lose weight. This is an energy deficit. This means there are two potential drivers of the increase in obesity rates in recent decades, either an increase in calorie intake, meaning we eat more, or we expend less energy in daily life through lower activity levels. Both elements are likely to play a role in the rise of obesity. Now, this disease is known as our public health crisis, affecting millions worldwide. There are definitely some telltale signs that increase your likelihood of being overweight or obese. Some of these are very applicable to us as well. If you are a woman, which most of us in this class are, you are more likely to be overweight or obese. If you have at least one obese parent, are from a low socioeconomic area, or are a minority, you are at more risk of becoming overweight or obese as well. Obesity is a risk factor for several of the world's leading causes of death, including heart disease, stroke, diabetes, and various types of cancers. Obesity does not directly cause any of these health impacts, but can increase their likelihood of occurring. If you are overweight or obese, you are more likely to develop diabetes, gallbladder disease and gallstones, sleep apnea, insulin resistance, and other diseases. Now, one may ask, well, am I going to be overweight? Is there a chance that I'm going to be obese? Do I have a fat gene? There are multitudes of studies that are ongoing in the realm of genetics and its role in obesity. And is there an obese gene? The most commonly accepted theory is that genetics intertwine with environmental factors and cognition to produce an obese individual. So there really isn't one source to blame for this epidemic. It's a very complex overarching issue. It is notable that family health history can be indicative in displaying health risks posed for future generations. It's not only the prevalence of obesity that plays a role, but also other factors such as underlying health, other co-founding risk factors, such as if you drink alcohol excessively, do drugs, smoke, or other lifestyle factors, and the healthcare system in your country. Out of any information in this presentation, I think this slide really shocks me the most. I thought it was quite interesting how worldwide obesity has more than tripled since the year 1970, and obesity is the most prevalent form of malnutrition. Obesity is the fifth leading risk for global deaths. The fifth leading risk out of anything that you could die from, the fifth leading risk would be obesity. 2.8 million people die per year due to this preventable disease. Most of the world's population live in a country where overweight or being obese kills more than being underweight. According to the World Health Organization, in a study they published in 2012, 39.5% of the world's population is overweight and 13.8% was obese. It is notable that this number grows yearly. The WHO also published in 2012 that 2 in every 3 women are considered overweight. That is an astounding number, and we have to do something to decrease that. If it didn't frighten you enough that, according to the WHO, 2 in every 3 women are considered overweight, then the physical, emotional, and social implications of obesity in women will be alarming. Obesity is linked to reproductive health issues in women, such as reduced fertility, decreased contraceptive effectiveness, gestational hypertension, gestational diabetes, birth complications that include preeclampsia, C-section, and postpartum hemorrhaging, and miscarriage, stillbirth, and neonatal mortality. And if all of those possibilities don't scare you, you could be subjected to weight stigma. This is also known as weight-based discrimination or weight bias. This is the act of stereotyping based on one's weight without knowing their personal narrative. Maybe they have insulin resistance. Maybe they come from an abusive household and eat to cope. Maybe they do not have any control with their portions. You don't know, but you are still judging. Weight stigma can negatively affect physical and psychological health within women. Currently, there are thousands of ways of how people can lose weight, but healthy treatment modalities vary greatly in terms of accessibility, doability, and monetary cost. Methods that are medically approved include increase of physical activity, creating a caloric deficit, cognitive behavior modification, drugs that decrease appetite such as Adipex, phentermine, Contrave, and Belvic, and bariatric surgery. Now, bariatric surgery does have some subdivisions that have to do with gastric bypasses, gastric sleeves, and duodenal jejunal bypasses, but these are the most expensive. The most popular ways to lose weight are to follow a caloric deficit plan and to work out more often than usual. And yet, despite the ways that are available to women to lower their body mass index safely, we still face barriers. Medical providers possess a bias towards overweight individuals, and this is known as being fat phobic or possessing fat phobia. These medical providers are less likely to fairly treat patients of a higher BMI than those patients in a normal BMI. Women can also have difficulty losing weight because as women, it is scientifically harder to lose weight because of the metabolic differences between a male and a female. Hormonal fluctuations from the time of when a girl first gets her period to the ending of menopause can also have a direct impact on weight loss. To lose weight after giving birth to a baby can be difficult, especially if you are breastfeeding and have to take in more calories than you would normally need. So postpartum weight retention is a big deal to new mothers. Toxic media consumption leads to unhealthy mentality towards a body. We all know that. Limited leisure time to incorporate physical activity is something that is faced by mothers that work sometimes 1, 2, 3 jobs and take care of the family. And this leads to placing the needs of the family above the woman who is trying to lose weight. And on that note, we are going to dive into part 2 of this presentation, which is the health issue in the country of focus, which is Mexico. Mexico is a country that is located in Central America. It is made up of 126.2 million people. Females make up a little more than half of this population. The birth rate is 18.3 births per 1,000 people. and the fertility rate is at an all-time low of 2.4 children per woman. The death rate is 5.8 deaths per 1,000 people, so it is evident that more people are dying than being birthed. The annual population growth of Mexico has dropped to 1%, as there are less marriages occurring while divorce rates have quadrupled. Now, I found this very interesting that when we glance upon birth rates, death rates, and their relationship to the prevalence of obesity, we find a positive correlation. Death rates tend to be higher in countries where more people have obesity, and we will get into that shortly. Mexico is a record-breaking country, as in 2013 it surpassed the United States, ranking as the most obese country in the world. It was noted that over 70% of Mexican adults are overweight, and one-third of Mexican children are also overweight. This rising obesity epidemic is also taking a huge toll on the Mexican healthcare system that is already very much faltering. In 2010, $806 million was spent for the obesity-related illness treatment of the people in the country. This number is expected to rise to $1.2 billion by 2030 if things do not radically alter. Now, despite all the negative data that I just fed to you, Mexico wasn't always like this, so there is a positive thought that they can always change. In the 1980s, Latin American populations experienced a shift in their diets as a result of industrialization of the food market. This is known as the nutrient transition. So many people in Mexico lived in rural areas and survived off of a diet rich in grains and fruits with little animal product. This soon became overrun by processed, cheaper foods. The transnational food companies became accessible in Mexican markets. Think Nestle, PepsiCo, Kraft, Kellogg, and General Mills. These products were lower in cost, yet lower in nutritious quality, so this completely had something to do with the obesity epidemic they are now experiencing today. Now, this concept goes hand in hand with the nutrient transition. It is known as the double burden of malnutrition. So you may be wondering, well, why didn't they just buy healthier products? Why didn't they just get fresher foods? Well, oftentimes these people couldn't. It is not uncommon for heavily obese concentrated areas of the country to be also considered food deserts. This is because healthier food is more expensive than the cheaper and processed foods available. $16,000 is approximately the gross income per capita. So, in layman terms, this is how much the average Mexican family makes per year. They do not have a penny to spare when it comes to food, so of course they are going to pick something that is cheaper. Children in lower economic bracketed areas are more likely to be exposed to inadequate prenatal, infant, young child, and adolescent nutrition because of this. This factor sets up for a lifetime of health issues. So essentially, if a young girl develops into a woman, she will have these set dietary patterns that, combined with low physical activity and possibly a low self-esteem, results in obesity, all while hiding the underlying malnourishment she could be experiencing. These young Mexican women then grow up to realize that traditional gender roles are unavoidable. There is also a clear emphasis on taking care of the familial unit in any way possible, even if this means putting yourself and your worries to the side. Over the years, more Mexican women have entered the workforce to support their families. 45% now hold a full-time job with minimum wages and no benefits offered, but they still need to take on that traditional mother, all-encompassing role. Life responsibilities are also placed on the woman, such as taking care of her kids, her parents, her husband's parents, the household chores, and this leaves little to no room for her. This is perpetuated by the social expectations of men and older adults that expect the woman to be the glue of the household. It really saddens me that in such a beautiful culture of such hard-working and family-orientated women, that self-care is essentially non-existent. I mean, they have no time to do anything for themselves, whether this is go on a walk, work out, prepare a meal that serves them nutritionally. You basically are told from the get-go that you need to place the needs of your family above yourself. The well-being of a woman is often pushed to the side to be the glue of the household. This really makes us think, how can we pour for others from an empty cup? We just can't do it. This idea takes us into part 3 of the presentation, which is ethical considerations, actions, and a summation of our findings. So, any type of change needs to begin with one individual, one mindset, and one striving to become a better person, physically, mentally, and socially. So, if we take this into the perspective of Mexican culture, we need to analyze the food aspect. Food is a part of the culture. Traditional dishes are not only the foundation of holidays and social gatherings, but they provide a proud identity to those who create the meals. If you do not eat something a family member has made, it could be considered disrespectful or offensive, and nobody wants to cause waves. We need to switch the narrative from life revolving around food to the food revolving around improving your life, and this could prove immense change. The Mexican government realizes that they need to get involved and do something about the country's obesity epidemic. However, they really aren't doing too well of a job at it. A measly 7% in the Mexican government's funding is allocated for various nutritional programs. Both public and private money is donated towards nutritional campaigns focused for people in low income and vulnerable areas. Now, I did say private money, so this ties into the 2008 Mexican Secretariat of Health pairing with Pepsi Cola to launch a health campaign aimed towards children. It was like a game where the children could pick which is a better choice, what activities to do outside, and when to go to the doctor. I just want to note that it is significant that PepsiCo, the same brand we discussed in regards to the nutrient shift, is donating money to the same children it is marginally affecting. Pretty crazy. The Mexican government recognizes the need to take preventative measures. Part of their efforts has been in instituting regulations. In 2014, it took the first groundbreaking step of implementing the sugary drinks tax. This made sure that any item that was nutritionally useless was taxed higher than something that was more nutritionally beneficial. This, however, backfired, and many families could not afford to buy food because of it. So, this was a total flop. The country has taken steps to improve its first line of defense, which is prevention, through its soda tax and public awareness campaigns, but more needs to be done and it needs to be better thought out, as it was affecting thousands of people and families. Another constraint to consider would be the modern sedentary lifestyle. The piling responsibilities of a Mexican woman that include taking care of her children and possibly her parents, working a job, and household chores leaves little time or consideration for activity. After a long day of work, possibly more than 8 hours, the last thing a woman wants to do is try to exercise. In 2012, the WHO published the first worldwide guideline of activity for adults, stating that if you fall below 150 minutes of moderate to physical activity, you are considered physically inactive. WHO's member states have endorsed global targets for improving maternal, infant, and young child nutrition and are committed to monitoring process. These targets are vital for identifying priority areas for action and catalyzing global change. So, getting 150 minutes a week is pretty important, but not many do it. The proportion of Mexican women who do not meet the WHO guidelines for physical activity has increased from 2006 to 2012 by 6%. So, we have reached a frustrating summation. The lack of access to fresh and healthy foods, the aggressive marketing of food products directed at children, and high exposure to ultra-processed food in homes, schools, and markets all contribute to an unhealthy environment that promotes obesity and affects developing young Mexican boys, and especially girls. In one of the most obese countries in the world, there is very little support for women. Women who are overweight or obese have often been this way for most of their lives, as because of the factors I just listed. Unfavorable habits have formed as soon as they are born. The health of a woman is pushed aside as there are bigger issues to be worried about, rather than a few pounds. The same manufacturers of food that malnourished the people have a significant hand in the government's community health promotion programs. So, in a country with strong cultural ties, there has to be a change within the perspective on individual health. It just has to happen. How can anyone carry on traditions if they are unable to breathe or speak without gasping for breath? As a viewer of this presentation and a member of the Women's Health Monmouth University class, there are a few significant takeaways I want you to leave with. The best method to beat obesity is prevention. Obesity is an overarching concept that affects all components of a person's life, and support must begin within the home and be supported throughout the community and countrywide regulational programs. We cannot do this alone. It is important to form favorable habits that can be continued over a lifetime, such as incorporating more daily activity and practicing food mindfulness and reaching for healthier options, and this will ensure a decrease in body weight. Supporting women in your life as they strive to be a healthier person is essential, and we can only make positive changes for ourselves and for the future generations of women to come, but we need to do it together. I want everybody to know that change is possible. You just have to be courageous enough to start. I thank you all for paying attention to my presentation today. I really enjoyed researching this topic. Thank you, Dr. Hope, for all your support during this class and for helping us gain a broader perspective on the amazing women in this world that endure so much.